Carol.
Okay, good evening, everyone. Just a reminder, we ask that everyone mute your audio and your video. That makes for a much better presentation and we won't have any background noise. The doctor has indicated that he's willing to take questions during the presentation. So if you'd like to type any questions in the chat or
Zoom, because the other one wasn't opening.
Somebody needs to mute here. And so you can either raise your Zoom hand or type your question in the chat and we'll ask the doctor, read the questions to him. This evening, our speaker is Dr. Sujahara. He's an ear, nose, and throat physician. He practices comprehensive general otolaryngology and has special interests in ear and hearing related problems, as well as sinus and nasal disorders. He earned his medical degree from Western University of Health Sciences in Pomona, California, and he completed residency at the Detroit Medical Center and a fellowship in otology in Seattle, Washington. Dr. Sujahara will review hearing loss and treatment options, including the latest technologies in hearing aids and surgeries. He will further review the health concerns of untreated hearing loss in the senior population. Doctor, if you would like to go ahead.
No problem. Here, let me go ahead and get my presentation up. Okay, can you see my presentation okay?
Yes, we can.
Very good. So thank you for the introduction and appreciate the opportunity to talk on this topic of hearing loss and technologies to address this. It's definitely has my highest interest and kind of one of my more favorite topics to address. Without further ado, we can go and get started here. So just as a disclosure overall, just so everyone knows, I don't have any direct financial support relationships with any medical device company or hearing aid company for that matter. The only bias that I might have is that I'm a physician. I work at a hearing center, which I'll kind of get into what that really means. To be specific, I'm located in Fullerton. Our practice name is Greater Orange County Ear, Nose, and Throat Head and Neck Surgeons with hearing services there. So from that perspective, I might have a little bit of a bias. Outside of that, I just want to disclose also that the content of this lecture, although it's very educational and important as far as health-related topics, it's not a replacement for individual medical advice, which would be more on a in clinic or in office situation. So we can go and get started on our overall outline. Plan to cover the different hearing loss types, the general health effects, treatment options, which largely are going to be the full span from over-the-counter hearing aids, technologies that are related, medical related issues, surgeries, and specifically hearing centers and what kind of services those provides. And definitely questions anytime along the way. If you have any questions, I'll try to address them or at the end, whichever you guys prefer. We'll go ahead and first look at the hearing loss types here. In general, when we're talking about hearing loss, there's three different types, categories altogether. Probably the most common, at least with aging populations, is going to be sensory neural hearing loss, which just means a hearing loss that's related to nerve function or how well you're able to hear that's related to the hearing nerve. The next category is conductive hearing loss, or something that's structural, that's not vibrating the sound efficiently or to the full capability to stimulate your hearing nerve. Mixed is the last category, and that's a combination of both of the above, either nerve related or conductive. And a few examples are just in these bullet points. So anything that's nerve related with hearing loss is a very common effect of genetics or aging. Loud noise exposure, if you're an individual in an occupation setting with machines, factories, engines, or even military concerts, these are kind of common situations that can give you a higher risk for more of a nerve-related hearing loss. Other examples for conductive hearing loss, wax or cerumen is kind of the medical term for that. Usually it's not too big of a hearing loss that can result in, but any other structure, the eardrum or the tympanic membrane is what we call that, or the ear bones or hearing bones called ossicles. Those are transmitting the sound from the eardrum to your nerve or the cochlea. And mixed would be a combination of both of these again. So there are a variety of different combinations of hearing loss that can result in much different ways to treat all of the above. And this is just a general diagram, and I'm going to kind of just point out outside the ear canal, and then eardrum. This is all external. Sometimes wax in here, sometimes swelling of the ear canal, eardrum related problems, hearing bones that vibrate sound to the cochlea, which is deep in the bone. And then from the cochlea, hearing organ, sound gets transmitted to the brain through the hearing nerve. Just a general sketch in terms of trying to understand how sound works. And I have a video that I'll show you in a minute here of what that looks like, how it's described, so you can kind of get a better idea of how the hearing function is actually transmitted. And here's the video that I'll play.
The process of hearing involves sound waves creating mechanical motions that cause fluid in the ear to move in waves and trigger nerve impulses that the brain interprets as sound. The outer ear functions to funnel sound waves. The vibrations from these waves reach the middle ear and move the tympanic membrane, also called the eardrum. This causes three bones, called the auditory ossicles, to also move. The bones make contact with a fluid-filled structure in the inner ear called the cochlea. The mechanical movements of the auditory ossicles move fluid inside the cochlea. Fluid waves move hair cells that line the cochlea. The movement of these cells activates nervous system receptors. Signals are carried through the vestibulocochlear nerve, cranial nerve 8, to the temporal lobe of the brain, where they're interpreted as sound.
So that was just a quick animation. They use kind of a handful of terms that are a little bit more medical, but I think the important part to get away from that is the visual of how sound is transmitted or sent from the outer part of the ear to the eardrum, to the bones, to the cochlea and the nerve, and then to the brain. So that's just kind of the route that sound is transmitted to the brain. The next step I kind of want to cover real briefly is hearing test. What does that look like? A lot of times, wherever you go for a hearing test, they'll give you a copy, hopefully review some of the details of the hearing test and summarize the findings for you. It's called an audiogram to be specific, or the hearing test. There's multiple parts to it. On the left here is a normal hearing test with the right side in the graph and a left side in the graph. And then on the right side of the PowerPoint here is a hearing pattern that shows a hearing loss. To be specific, now I'm going to show you here on the scale. This is a scale of volume. It shows -10, and then it goes all the way down to 120 on this scale. We mark roughly around 20 to 25. This is a decibel marker of volume. As you cross this mark here, there's different amounts of hearing loss as you go down. Each of these points represents a tone or a frequency. So these are the beeps or the sounds that you hear on that hearing test. And the point or volume that you start to hear that roughly 50% of the time is when we make this mark here on the graph. So down here, 250 hertz is a low frequency sound like a drum. In the middle range here, more of the speaking tones. And then at the highest end, 8,000 hertz is a high pitched sound like birds chirping, whistles, different things like that. I'm going to kind of put in the marker where we would consider roughly ballpark where normal is above that green line, and then below different amounts of hearing loss. You can see that on the left side for the right ear and the left ear, all of these points are above normal hearing. On this right side, we have a hearing loss pattern that it's just in the higher tones. You can see you cross this green line and you have a high frequency hearing loss pattern, which is very common. A nerve hearing loss is what this shows. Very common with genetics, aging, probably one of the more common hearing loss patterns. The other part of this hearing test, which I'm going to go into, important with the audiogram, is this score here, this percent score. Probably the most important in my opinion, the number or percent score down below. That's called a word recognition score or a word discrimination score. All that means is the percentage of words that you're able to hear accurately. So putting this graph together and how well your hearing is functional. So although this graph shows a hearing loss, this person is hearing 96% of words clearly, which is very good. Even though you have a hearing loss pattern like this, still capable of hearing very well. And it's kind of putting this into a big picture on how to really look at a hearing test, know what that means. Very common for people to say, I lost 20% of my hearing, or I only have 80%. It's a lot more complex and complicated than that. But these are just a few different ways that we look at hearing for a hearing test. One thing that I really want to touch on is the hearing loss or hearing level that each individual has and the effect that this has on your health and all different facets. One very, very hot topic is hearing loss and cognitive function or brain function or thinking function. And in this same discussion, dementia. It's a really hot topic in terms of what we're seeing with associations. And the association that we're seeing here is linear or positive, meaning as we have higher amounts of hearing loss, we're seeing a relationship with a higher degree or higher severity of dementia and earlier onset dementia. One thing that's probably the highest area of interest is if we can prevent that, if we can treat hearing, does that have an impact on dementia? And it's being very heavily studied in the US, and the government is putting millions of dollars in this area because Alzheimer's homes and care is millions and millions of dollars. And if we can delay from dementia occurring just 1 year, that's a lot of healthcare dollars and a lot more healthy individuals. But we are seeing relationships, more hearing loss, more risk of dementia as a potential effect, but it's more of a relationship that we're seeing. In addition to just the effects on the brain health, in that way, also the psychology behind things. As there's a higher degree of hearing loss, we're seeing an effect with social withdrawal. So not being able to interact with those around you with hearing and communication. So just basic friends, family interactions, we're seeing more isolation. And as a result, depression. It's not uncommon to see depression related with higher amounts of hearing loss. So very important to address these. Other areas with hearing loss, very common to see tinnitus or tinnitus. What this term means is a perception of sound. So it can be a ringing in the ears, it can be a loud roaring noise, a buzzing, any kind of white noise or perceived sound. A lot of factors that go into this, but hearing is one very foundational reason why you might have tinnitus or ringing in the ears. And a lot of times when you treat the hearing to various degrees, a lot of times that tinnitus does come down, but it's really an adaptation response by the brain. So it's really not a sound that you're actually hearing, but it's a response that the brain is creating because you have that lost hearing function, and your brain is adjusting accordingly. And just same with treating hearing loss or improving hearing, that same effect to reduce or decrease that ringing tinnitus sound can improve. And we'll kind of go into this a little bit later too. Now, as we kind of showed a little bit earlier, the inner part of the ear with the cochlea is the hearing part of the inner ear organ. It also has balance function, and it's all connected together. The hearing nerve and the balance nerve from the ear, they're bundled together in one. It's very common to see sensory neural or nerve-related hearing loss and decreased balance function altogether. Not uncommon to see these related. And when we treat hearing loss, a lot of individuals with nerve-related hearing loss with balance dysfunction or balance problems, when we introduce something like a hearing aid, not only does it treat the hearing loss in hearing performance, but the balance function oftentimes improves when it's inner ear related, and even the ringing and tinnitus is reduced at the same time. And the effects of hearing loss on your overall health and treating it has much more effects than just your hearing. And that's kind of the bottom line that I want to try to give out to you guys. Okay. Much bigger problem than you probably realize. I'm going to go into a handful of treatment options. In general, the technologies, there's a lot of technologies from simple over-the-counter options to hearing aids, which the bulk of it is in hearing aids, and I'll try to focus more on that, but I'm going to cover the whole spectrum from surgeries, different medical issues that we address. But first, I'm going to start with the over-the-counter and kind of work our way up with all of the different options. Over-the-counter treatments. Now, there are limitations to this, but it is an option, and a lot of people decide to go towards these options for a variety of reasons. The limitations are that they don't directly compensate for hearing loss because there's not a direct tuning to your individual hearing loss. And there's no professional evaluation, treatment, or programming in any way. So you're essentially getting an over-the-counter amplifying device and using that. Now, the factors that really matter if this is really going to help you or not with the over-the-counter options are your hearing pattern individually. So if the fit of your hearing loss and the device that you're using to help, or the amplifier, and the fit directly, whether it's in the ear like this, over the ear, what kind of performance you're getting with that overall. And to be specific, the type of hearing loss pattern, if it's mild, that's usually a pretty good starting point to get an improvement with an over-the-counter option. Or if it's more of a flat hearing loss, there's different things that can be beneficial with over-the-counter options. But in general, the over-the-counter options, although they're not always going to be the best because they're not really tuned to what your hearing loss pattern looks like. Now, a few examples that I'm going to just show here. On the right here, there's two options that are fairly common. Now, the category for these amplifiers, another term that you might come across if you look this up, personal sound amplification products, or just simply put, amplifiers. This first option here, the company is Etymotic. The bean, it looks like basically an earbud device. It picks up the sound from the outside and boosts it so you can hear it. One option, of course, plugging up the ear. Another option here by Williams Sound is called a pocket talker. It looks like a Walkman, if you're familiar with 80s, 90s, that kind of music device, but essentially a microphone and then a headset and the microphone picks up the sound, and the headset boosts up the volume so you could hear your surroundings a lot better. Two very common over-the-counter options, but again, limited in where that can be applied. There's a lot of smartphone applications and headphones that can improve hearing and hearing loss that are mild. One program or application, mobile ears, another AirPods like what I'm wearing right now, and a program that's built into the iPhone, Live Listen. I'll go into what this is a little bit later with some details that might be very helpful for a handful of individuals who don't want to take that leap to hearing aids, but want some kind of option.
I have a question in the chat.
Oh, yeah.
Okay. How to determine sensor neural? Is there an urgency to have it diagnosed and treated?
Tricky question. So yes and no. Let me just make sure I understand the question. So to determine the hearing loss pattern, we'd have to run a hearing test or an audiogram to be able to tell you if it's sensory neural or conductive. I should have put an example of what a conductive or even a mixed hearing loss looks like. On a hearing test, you'll actually have multiple lines with a conductive hearing loss or a mixed hearing loss versus a nerve-related hearing loss. So when we run a basic hearing test or audiogram, we'd be able to tell what kind of hearing loss pattern that is. And when we do a basic exam in the office, looking at the ear, there's different features that will suggest sometimes when there's a conductive hearing loss versus a nerve-related hearing loss. So essentially, a simple exam in the office with a hearing test can give us that kind of difference between nerve-related hearing loss and conductive or mixed. Urgency. This is a topic I was going to get into a little bit more in the medical section. There is an urgency in certain situations. The main urgency, which is not really well known in communities around, is a sudden hearing loss. A sudden hearing loss or a fluctuation in hearing loss. If you have a sudden nerve-related hearing loss, which we wouldn't be able to diagnose unless we did a hearing test and you had a history or a personal account that you suddenly lost your hearing 2 days ago, come in, get a hearing test, we see a difference with one ear being a little bit lower than the other, that is treatable. And it's a time-sensitive window to treat. So if you have a sudden hearing loss, you definitely want to get into an ENT office to medically treat that. We treat that typically with steroids in different forms, steroids by mouth and steroids with an injection form in the ear. It sounds kind of scary, but it's actually very commonly done, and we make it comfortable by numbing. But a sudden hearing loss is a medical urgent or emergent situation in ENT or ear, nose, and throat physician. So very good question. And that's probably less known to most populations. So a sudden hearing loss or a fluctuation in hearing loss is a treatable situation, but it's a time-sensitive situation. If you go more than 1 to 2 months, you really lose your opportunity to treat to recover that.
Another one is hearing aid the only resolution for sensor neural? I don't know if you're going to get into that later.
Yeah, I was going to go into a few different options. And great question. So the sensory neural hearing loss, hearing aids or some sort of amplification, over-the-counter options are there, but they're not going to tune as well as a hearing aid system. So 2 options there. I'll go into the hearing aids in a minute. The last option is surgical. And there's 2 different routes that we go with this. And it's really dependent on your hearing test. Surgical options, one's not as much invasive, meaning it's a lot more simple. Another one, a cochlear implant, is a little bit more invasive and surgical. That would require an actual device to be implanted into the cochlea to stimulate sound, but the quality is much different than musical acoustic quality that everyone is typically used to hearing. I'll kind of go into those options. There's a few options that are surgical there, but we'll go into some of those details with these slides as they pop up. But really the workhorse is hearing aids, and then a few surgical options for certain candidates. Hope that answers those questions.
That's all we have for now. So.
Okay, so I'll go ahead and continue on here. So over-the-counter options, possibilities for mild or certain hearing loss patterns, whether that's conductive or nerve related, but those are our first few options. And I'll go into one AirPods and live listen option for everyone here to explore as another option. Hearing aids. So we'll transition to kind of the bulk of the talk here. Hearing aids, a few basics. Hearing aids are meant to actually compensate for your hearing loss specifically. So they're tuned to exactly your hearing pattern to boost where you need it based off of your hearing test. And it's frequency specific is how that works. Now, in order to do this, it requires a hearing test and an audiologist. So the same person who runs the hearing test to tune that hearing aid device. All of these devices are FDA regulated, so there's a certain quality and standard across the board, which I'll kind of go into some of those details. I'll try to simplify a lot of the technologies there and what's out there. Overall, their majority are water resistant, not waterproof, so you don't want to wear them in the pool underwater or anything like that. If you happen to wear them out when it's raining, they'll, still function pretty well. Shouldn't really be a damaging risk. But overall, they're very durable. Nowadays, hearing aids, at least 5 or 7 years with proper care and maintenance. And that's kind of a key thing, proper care and maintenance. It's important. I can't stress how much follow-up is important here. For good longevity and function of hearing aids over time. Some people are getting upwards 10 years or longer in certain cases, and it all depends on what kind of care and maintenance you're getting for these. I'm going to go into some of the styles. There's a lot of different styles with hearing aids, and I'm going to kind of start with the most common and essentially the workhorse or the best that we distribute across the board wherever you're at. The first style is the behind the ear hearing aid, or BTE. It looks over the ear as in these two pictures. Sometimes there's custom ear molds like in this picture on the right for a better seal and fit versus a soft dome that you can't really see it on this one, but it partially seals in the ear. There's an opening also, but it kind of is a soft silicone rubber insert that has different sizes. And this one on the left is actually what we call an RIC or RIT, receiver in the canal or receiver in the ear. All that means is that the volume or the sound is produced in the device that's in the ear, versus this one, it's actually over the ear or behind, and there's a tube that transmits that sound into the ear canal. And there's benefits for both of these depending on your hearing loss level and your hearing pattern. One's a little bit slimmer, one's a little bit more bulky. In general, this one's a little bit more powerful, but slimmer option, a little bit more bulkier option if you need it. Kind of going in the different pros and cons on the right side. Now, this is such a workhorse, meaning that it can treat any kind of hearing loss, mild to severe or profound. It's very durable. It'll last you a long time. Repair rates are very minimal and low. Battery life can pretty much vary across the board. So it's kind of hard to really say how long that will really last, depending on if it's interchanging one or one that can be recharged overall. And this is kind of the whole spectrum that I'll kind of touch base on. So this is the first one that we're looking at, is behind the ear or an over the ear style. And the next one, we're going to go smaller and smaller and smaller. So the next hearing aid style here is in the ear or in the concha. The concha is this little bowl that's at the opening of the ear. And you can kind of see that this fits very nicely in that opening. And this is the hearing aid altogether. It requires more of a custom fit and a mold to design to get in here for this shell is what we call it. It's firm, it can be moldable, and it's very important for a good seal and fit. And of course, when you look at this in comparison, it's a lot lower profile, meaning there's nothing that's going over the ears. It's a lot more of a cleaner fit cosmetically. But again, when you start to go smaller with the hearing aid size, you start to compromise or give up other areas. So as the device is getting smaller, the boost is not as generally diverse. So it's better for less severe of a hearing loss to get this good boost. Overall, you can kind of see the other pros and cons here. The big one is the spectrum of hearing loss that this can adequately serve. So that's in the ear. In the
Quick question.
canal. Yeah.
What does the use of fair mean?
Sorry, say that again.
Use. It says the use is fair. What does use cover? What does it mean?
Oh, yeah. So the use is fair, meaning the different spectrum of how this is going to cover as far as hearing loss. So overall, it's okay. I don't know if that answered that question.
Not sure. I'm waiting for the person to say yes or no.
Okay.
Meaning effectiveness?
So that's a little bit of a trick question. So effectiveness, that's really going to be dependent on the hearing loss and the fit. So the key part that's really tricky. So hearing aids are, there's so much diversity, one in the styles which we're covering right now, and the technology options that you can build into it, that it's really, these are really long conversations of when we talk about effectiveness is what kind of hearing aid style and it's really your personal hearing loss pattern based off of that hearing test and audiogram, and what kind of factors that each individual is looking for to improve. One, to match the hearing loss, in my opinion, most important to match the hearing loss to boost it. I think that's the most effective, but there's other components with the actual fit in the ear, how well that's going to be performance with manual dexterity. So meaning a perfect example is if, as we're aging, some individuals aren't going to have the most stable hands to be able to take it out, to change it, the battery, or to basic care at home. So with different devices like these smaller ones, they're going to be much more tricky to handle, to take out of the ear, to change a battery if you need to, versus ones that are a little bit more easier over the ear. You can simply just take it off, put it on. Some have rechargeable batteries that you don't have to worry about actually opening these little doors to put a disc battery in. So the usability is kind of what the overall term is for some of these, as far as how that works. So effectiveness is it's a very, I think the one thing that's hard to really grasp is, when we talk about hearing aids, it's very much a match in terms of trying to fit as many parameters that each individual wants or needs, and your hearing pattern that you have, and the cost, because cost can really go up pretty quick based off of what kind of things we're looking for. The best analogy I can have on this is it's kind of like investing in or buying a car. Although the device is really for a car meant to get from point A to point B, with a hearing aid, it's a little bit different in that you're trying to select a good option to get from point A to point B to hear better. But as you start to increase the amount of options and technology, those different options and technology are essentially trying to mimic the features of a normal hearing ear. So it's tricky. The most basic type of hearing aid and function are generally pretty good, but there's different features that I'll kind of go over in here in a minute after the styles section that really are important in trying to comfortably and adequately boost your hearing curve so that you can hear better in all environments. So it's a very tricky concept. Hearing aid fitting, can't tell you how important a good fit is, because it's going to be different for each person's scenario altogether.
If a person wears glasses, does it impact the style of hearing aid that's the best?
So that's a great question, and that goes into the conversation for a lot of individuals. And I'll tell you, nowadays with especially the pandemic, we have masks over the ear, we have eyeglasses over the ear, and we have hearing aids, the most common option over the ear. So when you have things like this that are competing with space on the ear, it can make it a little bit more challenging to use. So that is an influence or a factor. It doesn't stop from recommending a certain style over another. The comfort with over-the-ear options are excellent with eyeglasses. It doesn't stop or change recommendations strongly to suggest something off the ear or completely in the canal, or like these options here. So that's kind of really more of a comfort situation. Although the comfort is very negligible, meaning it's not usually enough of an impact to recommend away from something over the ear, but certainly if your hearing loss is not too significant and the in the ear canal or in the concha or in the ear is an option that you want to explore, and it would make sense to boost the hearing pattern that you have, that's an option. But when we look at these, so as you can see, everyone's ear is a little bit different shaped. When you have these ones that are in the canal or in the ear, it requires more of a custom fit to fit in here. And with custom fit, price goes up because it's got to be molded to your ear exactly to be able to get this benefit. So that's where cost, unfortunately, is an economic thing with hearing aids and technologies. So that's where it can really vary depending on each individual's budget and thoughts on terms of what your range and flexibility is, because at the end of the day, it's truly a fit with your hearing performance and how it fits in your ear and anything else that's related to this. So eyeglasses, it's not in my opinion, it's not a big factor. Some people might be more sensitive to this than others, though.
Okay, we have a few more questions, but I think they
Sure.
deal more with the programming of the device. So we'll hold off on that for a bit. We'll finish up with the styles. Okay,
no problem. So I'll go into more of the styles, which we actually kind of covered here briefly with the kind of the fit and the general trend, which as you might have picked up here, as you go smaller with the device, your range to cover a higher amount of hearing loss is less. Although the cosmetics get better and better and better, the performance can be a lot more sensitive. So when you completely plug the ear canal, you have sometimes feedback issues, how things transmit with sound. Sometimes it can feel very bass heavy or noisy in some cases. So there's a lot of very specific fit issues that have to be addressed for these to work out. But in the ear, full concha like this, lower profile, more of a custom fit. Going into the next step, a little bit lower. So it's not in the full bowl here, but it's in the lower portion of the bowl towards the opening of the ear, but similar idea, kind of more of a custom fit in the ear. It addresses less of a hearing loss, so mild to moderate, but overall, a pretty good device still for a majority of individuals, just more of a custom fit that's required. The last category is essentially any device that's in the canal and it's minimally visible, whether it's completely in the canal, CIC, invisible in the canal, IIC. All of these are very similar. Lyric is another one that's a little bit different even. It's in the same category inside the ear canal, but it's one that you actually don't remove, and it's removed every 2 to 3 months by a professional and placed there. So it's more of almost a disposable like option, but it's very limited candidacy, just like all of these ones are. That it really, although I put moderate severe, it's very unique cases, but it's really more mild to moderate kind of a hearing loss that this covers. But with the small size being completely in the ear, they're very delicate. So they tend to be a little bit more fragile, more susceptible or sensitive to any waxy environment in the ear. Because it's a complete plug, wax is going to build up a little bit easier. But overall, that's kind of the general trend. The main, most common ones over the ear. As you get more cosmetic and small, the boost is a little bit less. This is just a slide. It's not limited in terms of the manufacturers that are out there. There's a lot of manufacturers. I just put up here probably the more common ones. Oticon, Phonak, Resound, Savantos. All of these are very common companies and brands. With our hearing center, I would say the most common that we dispense are Oticon and Phonak. A variety of centers are going to be kind of similar trends. One area that I wanted to bring up that there's a handful that are out there is Starkey. Starkey is a company that has a little bit older and refurbished options that is an option for hearing aids. They're more affordable in the cost, but because they're older, refurbished, the technology isn't as good, and there's not really a warranty or as good of a warranty with the device. So a lot of times when you see these, you just kind of be under the understanding and know-how that sometimes they can be used for older or refurbished situations. So as long as you're kind of aware of that, sometimes that's a good option for some people. So this is kind of a busy slide. In general, I don't like to put too much writing on slides, but I try to put a little bit more here just in case for people to reference, to read on this a little bit more. But with general hearing aids nowadays, the technology is digital. There's really no analog hearing aids anymore, at least that are currently being produced on the market, unless it's an older one that's kind of still lingering around. But all of the hearing aids nowadays are digital with the signal processing. Now, what this means is that there's generally a higher quality, so more frequency bands and channels to amplify and boost sound, so better tuning to your curve, and a higher resolution overall. One area of technology is compression, and this is pretty important for boosting sounds comfortably. The idea behind this is with each hearing curve, you're not going to be boosting things one-to-one, meaning sounds that you're already hearing pretty well, you're not going to boost it the same as sounds that you're hearing terrible. So with each frequency, you're going to boost things just to where you need it. But with compression, to try to keep things simple, the idea with compression, this is built into digital technology, is that soft sounds are going to be amplified more than loud sounds, so that it's comfortable within your hearing range. Now, there's also a lot of programming of settings that can be done for hearing aids to a variety of conditions. So a certain setting for when it's quiet, certain settings for a noisy environment, going out and about, and you can kind of flip back and forth between these different settings for the hearing aids. Other things in hearing aids, batteries. This is kind of a very simple thing to think about. Batteries and how much you have to change them out. They don't last forever. They're little disc batteries. The more that you wear it, the more that it's going to go through it. In general, disposable disc batteries, depending on how much power you're supplying to it and depending on how much you're using it, you can go through batteries 15 hours to 30 hours on a single battery for a single unit. Rechargeable batteries are starting to be more and more common. It's more convenient. You don't have to change them out. You don't have to worry about any manual stability or workability. So you just simply put it on your charging dock. When you go to sleep, you take it off, you wear it, and it lasts easily 24 hours of use or longer. Typically during the day, you're not going to be using it to the full 24 hours. Take it off when you sleep, and more often than not, it's going to last you each time you use it, and it's going to be on the charging dock. But again, different technologies simply like that is going to change with the cost, and it's going to go up a little bit. Another area of technology called acoustic dampers. This is more with the tubing in certain over-the-ear hearing aids, that it's going to help with smoother sounds. It's a little bit more comfortable in terms of the fit. It's really the tubing is what it is. It gives a little bit more quality of acoustic sound and comfortable sound. Just kind of put that into quality and comfort, and the style. So the ones that are directly in the ear or complete in the canal won't have these features. So certain things to kind of think about as far as the quality. Hearing aids, most will have some sort of volume control, not all of them, with a remote. So being able to adjust the sound settings, some have that pretty easily, some don't. But it's another area that can be modifiable or adjusted with certain hearing aids. This is a unique scenario. So when we talk about hearing aids, usually it's going to be on one ear or both, most commonly on both, to boost each ear. This is a unique scenario. Let's say you had one ear that was deaf and one ear that was generally pretty good or normal hearing, or maybe a little bit of hearing loss. In this scenario, let's just say this pink hearing aid had a deaf ear in it, and your other ear had a good ear or hearing ability. This hearing aid has the capability to route the sound to your good hearing ear. We call this a cross or bi-cross hearing system, that for individuals with one non-functional ear and at least some hearing in the other ear, we can route that sound to your good hearing ear. And that's all wireless through, it looks like a hearing aid, but it sends this all wirelessly to your other side. So kind of a unique scenario for a hearing aid and the technology that's there nowadays, essentially the wireless ability to transmit that signal.
I have a couple of questions on the technologies.
Yeah, go ahead.
Can hearing aids be programmed not to amplify sounds like firecrackers or fire alarms? In other words, can they be programmed to not amplify sounds over a defined loudness?
Good question. There can be different triggers of volume to potentially cut out. It's not very common. Now, when we're talking about it, it sounds to me that the concern or question is these sudden loud sounds to be able to cut or switch out. I'm not sure that there is an effective switch for that. There are, however, different settings that are more automated to flip between different types of hearing aid settings. So there's some conditions that you might be able to change how much sound is amplified in certain settings that you could switch. But in general, for that kind of situation, it's not going to be one that would be able to easily program. So for really these background noises that are sudden, high, intense sounds that are not going to be easily predicted, there's really not a good trigger to kind of drown out these noises. And actually, I would be it would serve, to me, it would serve the direct opposite purpose. With, to be honest with this, although hearing aids are going to be boosting your hearing and improving a variety of other health effects, one important thing to remember is that with hearing is also safety. So if you're not able to hear a car coming across the road, if you're not able to hear an alarm that's going off, if you're not able to hear a siren that's coming from down the road, these are all important sounds that you actually want to hear for safety purposes. I understand the firecracker situation, that one's going to be hard to really get around. It's not a perfect system, but for things like fire alarms, sirens, those are actually important sounds that you want to hear, although they might, they are uncomfortable. They're very loud. The hearing aids are going to boost those too, to the point that you can hear it and that are going to be uncomfortably loud for anyone that is going to be able to hear well. or hear well with a boost. So in general, I wouldn't be so much concerned about the risk of a sudden loud noise like that at this point. If you had a high intense loud sounds that were carried over a certain X amount of time, that would be a higher risk than a sudden acoustic trauma such as a firecracker. And usually it's going to be more of an explosion that's going to be more of the real risk for permanent long-lasting damage. So if it's a siren, if it's a loud whistle, if it's a firecracker that's maybe a few seconds or so, and generally that's not going to be too bad.
Okay. There's several questions on ambient noise at a party or a restaurant that drowns out conversation. And
this is a great question. Great question. So background noise, very, very common question that I see in the office. People interested, what can I do? And I'm going to cover this actually in this section right here in a minute. So the next few slides and beyond, I'm going to cover the background noise, hearing in a restaurant, probably the most common issue that we're all trying to hear better in. Is there any other questions outside of that one? I'll cover that one in a minute.
We'll get to these other ones in a bit.
Okay. So so this section here, hearing aids and technologies or these accessories. So telecoil or T-coil, Bluetooth, and I have another slide that follows this. These are all essentially very similar category of wireless signal transmission. So sending sounds, whether it's from a little microphone that you're wearing around called a neck loop, or a room loop where there's a microphone that you put on a table in front of a TV. It's going to send that directly to your hearing aid wirelessly in your ear. And this is actually one method to better hear a noise. So that's one condition that can actually help if you're in a restaurant setting. So there's I'll kind of go over on the real principle that drives how well you hear a noise, but this is one feature with a hearing aid that can improve hearing and noise, just to kind of simply put it. There's a lot of other factors that we'll kind of go over with the concept, but Bluetooth, similar technology. It's wirelessly sending a signal, whether it's from a TV, a computer, a cell phone, directly to your hearing aid. And iPhone, among other smartphones, are already ready and programmed with hearing aids like Phonak, Oticon, Resound, among many others. And this is in really the category of remote microphones. So Bluetooth, telecoil, there's essentially a microphone built in somewhere, and it's wirelessly sending that to your hearing aid device. That's kind of the general category there. There's a lot of different terms for these, but they're essentially very much the same thing. And this is where you're going to get better hearing and noise. And I'll directly address that scenario with hearing in a restaurant in a minute. Now, sometimes there's smartphone apps that can really help with programming hearing aids in different types of settings, changing the volumes, different things like that. And even landline phones. There's some landline phones that have the wireless capabilities to send it directly to a hearing aid with either a manual switch or an automated feature. So these are all different technologies that are basically wirely sending sounds from the environment or the phone or TV directly to your hearing aid to help with hearing and noise to a specific degree. And to kind of go on this is the slide that's going to be important to really get at how this is going to help. So the factors that really matter the most. So, I hear it a lot. I'm in a mall, I'm in a restaurant, there's background sounds, I can't hear at all. And it's going to be a struggle. The reason for that is this SNR, a signal to noise ratio. Two different factors here, okay? The signal, the speech signal loudness relative to the background noise. So you really want an increased signal or the person talking in front of you and the background noise to be less. Okay, that's what the ratio there that's going to really drive how well you can hear in this environment. So you have one option, increase the signal. You can increase the volume, have two hearing aids. One is not going to be as good as two. Have a remote microphone. This is pretty key to increase the signal. It's kind of tricky with hearing aids because it's going to increase the signal, but it's also going to increase the noise in the background to different ways. The other thing that we really want to do is decrease the background noise, noise cancellation. Okay, so there's not a true noise cancellation, with hearing aids, but there is a caveat to that. To decrease the noise is having the same effect as noise cancellation. Now, there's methods to changing or modifying your environment to hear better in a noisy environment. So if you're at a restaurant, something that's very simple, sit in a booth so you're not at a table that's open. Having a high booth behind you is going to drown out any noise behind you or in front of you. If you're not in a booth and you're at a table, for an individual with hearing loss, I want to be facing a wall. When your ears are positioned like this, as sound is around you, you're going to hear the most that's directly in front of you. If you have a lot of noise like a kitchen, you don't want to be facing the kitchen because all that sound is coming right at you and it's competing. So simple things that you can do in a restaurant, if you're the one with hearing loss and you're struggling to hear, sit in a booth, face a wall, sit away from all of the noise. Very simple things. So if you're in a restaurant, go away from the kitchen if you can choose that. The discussion that's around you, the conversations, face a wall, be in a booth, that'll decrease that noise or that SNR problem point. The other part that's going to help is, of course, increase the volume of the people speaking to you. You can't really tell them to talk louder. Sometimes you can, but it's not going to be easily done. Hearing aids is going to help boost that if you're already setting yourself up with a good environment positioning. But there's different parts that I'm going to go into detail with an example with a remote microphone that a lot of people can try at home. That's the SNR, one very important factor with hearing in noisy environments. Squelch. This is a audiology or medical term that essentially two ears are better than one. Okay, binaural or binaural, two ears. When you have signals from two ears for sound, your brain combines them together. Okay, if you have one hearing aid, you're not going to hear as well as two hearing aids. And your brain does a lot of processing. If you have a lot of noise that's coming in, background noise, your brain is going to filter out or depress some of that background noise to a degree and focus in on where that sound signal is coming from those speaking in front of you. So having two functional or boosted ears is very important in addition to the SNR or signal to noise ratio. Okay. One and last kind of important matter that is important with technology is auditory deprivation. This is a term that relates to the length of time that you have a hearing loss and how long you go without treating that. Essentially a duration of hearing loss or duration of deafness. The longer that you go without addressing it, the more negative impact it has on any treatment effect that you have to boost your hearing. Essentially, you can think of it as if you don't use it or treat it, you lose it in terms of the ability to hear better, regardless of having a hearing aid at a later time. So overall, a very important concept. It's very important to amplify early, boost hearing early, so your brain doesn't lose that capability to hear better when you want to treat it. And I'm going to go into a few other important technology factors that do actually matter. And this is more emotional. So, despite all of the pros and, cons that are out there, the stigma, a very big one. Although there's a hearing loss, a lot of people do not want to treat this and put this off for a long, long time. And the stigma, having hearing aids, they look and feel old. I get it. I see it. There's the stigma in society. You have a hearing aid, you see it over the ear. It has a negative connotation. and most are expensive. You know, this is the general truth that's in society and that we see, and it's a factor. You know, it prevents people from having this treated and trying to address the hearing loss and the overall effects that it might have on individuals, whether it's relationships at home or the individual at health. You know, if you don't treat the hearing loss, the result is, you know, you're going to be keeping on asking others to repeat themselves over and over, and you still might be missing out on conversation. You might be more withdrawn, isolated, lonely. But in the flip side, if you're able to hear these conversations and what's being said around you, you're going to be more engaged conversationally, emotionally with your family and friends, and as a result, have better relationships and have, you know, on the one side, depression on one extreme, and on the flip side, kind of a good emotional state. So, you know, there's a lot of emotionally driven decisions that go into deciding whether a hearing aid is good for you or not. But let me give you a very good example of what you could do at home that's over the counter that actually takes this stigma away. And it's very much driven in technology, like these AirPods or Bluetooth hearing devices that you can do at home. So let me show you this next slide. This is one slide that I starred, and I don't star slides very often. This is the one that I put in this lecture or talk that you can try at home to help with hearing, especially in a noisy environment. If you have any kind of headphone and an iPhone. So I have an iPhone. I'm a little bit, you know, biased because I have an iPhone with being able to give you this information. I don't have an Android or any other smartphone. So I'm kind of just giving this example based off of what I know and what's out there based off of the iPhone and technology. So this is a situation where you can set up a remote microphone at a restaurant just at home. And all you really need is some sort of hearing device or a headphone. So an AirPod is my example here, and my iPhone. And using this at a restaurant would enable you to increase that signal, so in the ear, and actually decrease the background noise, because these actually have the pros, AirPod Pros have noise cancellation. So this is where it's unique. And you can actually have this feature with or without a hearing aid. But if you want to try this without a hearing aid, since it isn't technically an over-the-counter option, you can try this. And I'm going to actually walk through the details of this. So if you want to take a picture of any slide, this would be the one to take a picture of. And you know, if you're having a hard time trying to filter out how to do this at home, take a picture, show it to the millennial that's in your life, and they'll be able to kind of take you through this. It's very simple. Live Listen is built into every single iPhone. With, I think it's a software version of 14.4, which is, you know, with any updated iPhone software, you're going to be there. But how you do this, go to the settings tab within your iPhone and go to the control center. Within the control center is a list of included controls. So all of these that have the red a signal right here means that it's in your control center. What you're looking for is the hearing program or the blue icon with an ear on it. If it's a little bit below, not in this included control center, either click the green button below and that'll bring it up top, or you can just kind of drag it up here. Once it's in this section, then you're ready to go. You're going to go back to your home screen, and you're going to swipe from the right-hand corner down to get to this screen right here. What you're looking for is this icon right here, that same ear. That ear, you're going to click on it. When you tap on that ear, you're going to get this next view right here. It says it's off right now, but when you tap that with your finger, it's going to turn on and activate the microphone system. So this is actually my ES AirPods Pro. That's what I label my in-ear device. When I click it, it's going to turn on right here, and you can increase the volume of this feature. And how it works is it's going to be a microphone that's on the phone here. You put this on the table in front of you, in front of the person that you're talking to at dinner, and they're going to be picking up the volume of that other person in front of you through here and transmitting it directly to your ear. And this is a remote microphone that you can just simply do at home. All it requires is a headset or a headphone and your iPhone, and you got an improved signal, decreased noise from the background if you have the pros to noise cancellation. And this is going to improve significantly your hearing performance in a noisy environment. It's not going to be perfect because it's not tuned to a hearing loss, but if you had a hearing aid and you paired this up with a hearing aid, you're going to hear phenomenally in a noisy environment. And it's very simple to do and set up. And there's a variety of different things that we walk through to help get this set up for patients. It's just really knowing what the technology is out there, your hearing loss, and applying it to your situation. If you're someone that's out and about, very important with this. If you're more at home, pretty quiet, it may not be that important, but setting it up with your TV might be more important. But a very simple and easy thing to do at home if you want to set this up. So that's kind of the hearing aid section that I have overall for the technologies. I'm going to move a little bit more now to the medical side of things. So surgeries, there's two main ones to help improve hearing in addition to other very medical specific situations. Surgeries, cochlear implant is one, and this is more with a severe or profound nerve hearing loss. You can think of it this way. You're probably a candidate if you have hearing aids and you still can't hear. So it's got to be pretty significant, that hearing loss. That's one scenario to help with a nerve-related hearing loss. And I'll show pictures on this in a minute. An osseo-integrated implant. This is another type of implant that's a little bit different, that addresses a conductive or mixed hearing loss, or if you have deafness in one ear. It does require some degree of nerve hearing function to boost that hearing. So this is kind of a little bit different than a cochlear implant. It boosts more of that conductive type of hearing loss pattern, but it also addresses deafness in one ear, just like that cross device does, but it stimulates the other ear directly. Other types of surgeries are more specific to the type of issue. A tympanoplasty will repair a hole in the eardrum. Exostosis repair is more of a narrowed ear canal because of a surfer's ear, which is a common issue, especially in California. An ossicular implant or a hearing bone implant, if you have damaged hearing bones from, usually it's chronic infections, different things like that, or stapedotomy or stapes surgery. A lot of times it's just one hearing bone that's stiff due to a medical condition, and we can replace that and improve the hearing quite a bit. Here's a general diagram of what a cochlear implant procedure looks like. An incision behind the ear, and it fits the cochlear implant. The surgical part of it is underneath the scalp, sitting on the bone, and it's implanted through drilling an opening behind the ear, and where the electrode is inserted is directly in the cochlea. So this is all underneath the scalp, in the bone, is the surgical part of it. And on the outside is the second part of it, which is that at-home device. So once you're healed from surgery, the outside device, there's a variety of different companies and types. Most of them attach to the implanted device by a magnet, and there's an outside processor that picks up the sounds and sends it to the internal part to stimulate the hearing. Most of these sit on the ear like this, but there's a newer one that actually sits off of the ear. And if you have longer hair, sometimes will actually be hidden pretty well. But this is a little bit more specific for individuals with a high degree of hearing loss and don't get benefit from hearing aids. A lot of different companies, colors, and styles. The osseo-integrated implant, or Ponto or Baja, is some common names. This is the other device that's actually implanted into the skull of the with the bone, and it directly stimulates the cochlea through the bone, but it requires a relatively functional or a healthy nerve to receive that sound to get that boost. So it's a different kind of implant. It's not as big of a surgery. It's pretty quick and very good with the healing. But this is kind of what it looks like. It's very small, and the device just clicks on and clicks off. And there's a lot of different colors to match your hair or go within the hairline. So this is another surgical option. Just like this last device that was surgical, the idea is that it transmits the sound through bone. Just like you can have an implant, as long as you have a contact with the bone, you can still transmit that sound. So there's a lot of bone conduction types of hearing devices which are out there, such as the sound arc. It actually contacts the bone that's right next to your ear, and it transmits it directly down. And same with this device or a headband. We actually use these in kids quite a bit when there's a certain kind of hearing pattern to help transmit the sound, because they're not quite big enough or old enough to get that kind of implant. But these are sometimes situations that are more unique to transmit sound through the bone to the inner part of the ear. And a lot of these are actually, some of these are actually over the counter for headphones that are out there. Here's a few other surgeries that are specific to a medical problem. So if you have a hole in the eardrum, this is kind of what it looks like. Tympanoplasty is a surgery to patch that up, help with the hearing loss that's related to that. Ossiculoplasty or ossicular reconstruction is reconstruction of the hearing bones that are damaged with an implant. So this is kind of reconnecting the eardrum with a metal implant, usually it's titanium, and reconnecting that chain of hearing bones to the cochlea. So very specific problems for medical conditions. And just like that one was repairing a bad hearing bone, a stapedotomy is a similar category where you're still replacing a hearing bone, but it's that last stapes or stirrup looking bone right there that connects the chain to the cochlea. So you're removing a bad bone, inserting a good implant that can mobilize or vibrate. And that's the problem bone. I'm going to go in a few different options here that I want to kind of get across. And as a hearing center, we see issues that pop up here and there. But anyone that has military background, the VA is a very good resource for hearing loss evaluation, hearing aid services at no charge. Anyone that comes into our office with any kind of background like this, I offer that option every single time. It's a great benefit to have. But sometimes these services can be a little bit lengthy and challenging to kind of get done, but it is a good option, and there's a link for reference for anyone that has a military affiliation. Just as military affiliations have their route of service, there's a Department of Vocational Rehabilitation that can help people with hearing disability get and retain their job. So if there's any pushback or issue with hearing loss in your job, this government-based entity is there to support you. And this is just some of their contact, website, phone number, email, as a government organization to help anyone with hearing loss and their job. It's a real problem for some people. Kind of the last thing I'm going to cover today is hearing centers. I do work at a hearing center, so just kind of, I'll give you a little bit of what a hearing center, a true hearing center is, and a little bit of an example of my hearing center model. A hearing center really has two major components: a physician, or at least one physician, usually it's ENT, ear, nose, and throat, or an otolaryngologist, or an otologist or otology or neurotology, anyone within the training to take care of ears, plus an audiologist or someone who can test the hearing and tune hearing aids. So you're able to provide all services, all treatment options to your patients. It requires medical clearance to see if there's at least offer any medical surgical situation to help with your hearing if it applies. And then, of course, hearing testing and treatment, depending on what everyone's goals are. And again, just kind of reiterate, probably the important thing here is that all treatment options are there for patients, and the follow-up. I can't reiterate how important follow-up is even for hearing aid patients. A lot of times we dispense the hearing aids and have follow-up because there's a lot of target gain or boost that you can't always get right away. And the brain is very plastic, so it's always changing and connecting. Even after you adjust a hearing aid to the optimal boost, after about a month or a few months, your brain is actually modifying and reconnecting as those new sound signals are coming in. And as they're coming in, it's going to actually sound quiet after a few months. So a lot of times there's another wave of boosting as you kind of go across that full calendar year with hearing. And we call that central adaptation by the brain, or adjustments or plasticity. So not only is there that constant improvement potential by your brain, but the care and maintenance of the actual unit. So a lot of times you may not even notice that there's something wrong with your hearing aid because it's such a gradual change over time that you don't really notice these big improvements or decreases in performance until it's too late or too far gone. So very important for follow-up care with a hearing center that's a medical model with a physician and audiologist.
What is the medical clearance for?
Yes, so the medical clearance, a lot of times when we look at a hearing test, and this is, you'll see this at a variety of places that don't have a physician. And with audiology, when you see essentially what it is two different kind of conditions. If you have a conductive hearing loss or a mixed hearing loss, so something that's vibrational or structural, that it's not transmitting sound, that's potentially fixable. Hearing can rarely be fixable because anything that's nerve related, usually that's something that you can't do surgically to boost back to a normal level. But with something that's conductive with the hearing loss, like a hole in the eardrum, you could patch that up and get back to your baseline of hearing. So medical clearance means that you're checking on certain conditions that could be treated medically before looking at these other options like hearing aids. To get you to hear better. And there's certain conditions too, when you have an asymmetry. So if you have same hearing in both ears, it should be the case for everyone, unless there's certain unique situations. But if it's a nerve hearing loss that's different between the ears, it's important to have that evaluated, because a worst case scenario is it could be a tumor. And if it's a tumor, then we manage these differently. And if you try to treat things too early, you may be using a hearing aid when it could be ineffective if that tumor creates more of a hearing loss in that one ear. So it's really a few conditions that require medical clearance. If you have a hearing loss that's similar in both ears, that's kind of expected for your age, sometimes that it really doesn't need true medical clearance. But some of these places that don't have a physician will actually send you out to a medical office to get clearance first, because you have a different kind of hearing pattern that's not typical. So that's usually what that means. So it's usually done all in one visit for our office. So here's that section right here. So the medical clearance is really in this first medical aspect. So whether it's wax removal, eustachian tube problems where you get fluid that you could drain out, address the vibration conductive loss, or a sudden hearing loss, which is an emergency. Sometimes that can be done to treat to regain hearing loss. Or if there's an asymmetry, hearing between the ears that's different, that needs to be medically evaluated and make sure that there's not more that needs to be done. And a lot of times with these hearing centers with medical models, we have same-day access to hearing testing and treatments or evaluations with ENT. I can't tell you how many times that we have our hearing aided patients that are going in for hearing aid checks to reprogram, retune, or to service them to help with the function. And you have wax buildup, and something that's as simple as that, they can just send over to our side of things, clean out, do a hearing test, see what your hearing level is, and then boost that accordingly all in one go. Versus if you didn't have that, you'd have to have a separate appointment out to a physician's office, get sent back, do that hearing testing, and then do an adjustment. So 3 visits instead of 1, potentially in certain case scenarios. But in general, for my hearing center or office, I can kind of tell you how we do it. I'm not really sure how a lot of other places do it, but it's essentially a medical evaluation by either myself or any of my partners, a hearing test, and then providing you those options. And we really pride ourselves with follow-up for continuous care. And I can't really emphasize how important it is that follow-up is even after you get a hearing aid or get an evaluation for treatment that's surgical, because a gradual decline in performance with the hearing has significant impact and can be addressed if it's routinely evaluated and followed up for. We really consider specific needs and individualized care. So it's really a conversation with each patient. What our goals are, your levels of hearing loss with the testing, certain needs directly if you're in noisier environments, if you're, more at home and kind of in a controlled, quiet setting, certain measurements if it's applied for a hearing aid, checking insurance benefits, which is a huge one. We build that into our hearing aid evaluations. A lot of times, a variety of centers don't actually check your insurance, and you may not even know you have a benefit. So a lot of times, something simple like that goes a long ways to simply know what your benefit is. We check that for our patients. So it's pretty important to really fit as many things as possible with each person. And try to achieve the goals that we need. And, there's a lot of factors, whether it's monetarily or fit, looks, emotional issues, but we really try to hit as many as possible and try to get a good solution for each person, whether it's over the counter, if we can't get a good hearing aid system, or just picking one versus two, different Bluetooth features, remote microphones in noisy environments, those different things. So all very individualized care, and we really do our best for our patients here. And this is my my work team and family over at Greater Orange County Ear, Nose, and Throat Head and Neck Surgeons. We're a hearing center of 4 doctors, 4 ENT physicians, and myself, I'm one of them. I'm an otologist or ear trained, subspecialty, extra training with a fellowship in just ears. So that's kind of my favorite aspect of ENT, but I still do general ENT altogether. We have 3 audiologists right now that help with our care among all of our ancillary staff to kind of help with everyone. We're located in Fullerton, right off of Harbor, near St. Jude Hospital. And I'm going to try to transition into questions here. I have a slide that I'm just going to kind of start it off that I'll tell you, these are probably the most common questions I get right off the bat. How much do hearing aids cost? Typically, each unit, so each ear, roughly is $1,000 to $2,000 each. It can kind of vary between places and facilities, but the more technology that you add in there, the more that you need or want, that cost can change pretty quick. And the cost is always built in with all of the aftercare and follow-up. So all of that's kind of built into the care of that hearing aid. There's so many different models and technologies, very similar to a car, many options. The closer a hearing aid is to functioning like a good hearing ear, the more technology that's really needed. And that's where cost can really play a role. But, it is a part of the picture, and that's where that conversation can get very specific to each person. And the other one is when to get a hearing aid evaluation or consider hearing aids. Now, I hear these phrases so often. I can hear you, but I can't understand what you said. Or I'm hearing fine, but I can't hear clearly what was said or on the television. Or I feel like everyone is mumbling around me. And this is where true hearing loss is happening. We hear sounds around us. It's the clarity or the word recognition that has the impact. So when you start to actually lose your hearing nerve related, you're not hearing words clearly. You're not hearing those letters specifically. So you're losing that word discrimination, or that word score is going down. So when you start to feel like people are mumbling around you, although you're hearing sounds, you're not hearing clearly. And that's where you truly have a hearing loss and should be at least checked out, so you know how much a hearing loss is and and how much of an effect that could have on your personal health. So if there's any questions, I can certainly address them. And thanks for listening, everyone.
Okay, thank you, Doctor, for giving this presentation. There are still a number of questions in the chat.
Sure.
I'll shoot through them quickly. Is there a style of a hearing device that stays in place better than the others?
So staying in place, two different parts to it. Staying in place inside the ear canal there, and or if it's an over the ear, that's going to be an important part too. Staying in the ear, now there's two different types of insert into the ear, ones that fully occlude or plug, and then ones that don't. And this is where it's tricky. As we age, the ear canal opening starts to change, and sometimes it can get narrow, and sometimes it can be hard to fit. And that's where a medical side of things is pretty important into the input. So a lot of times I'll communicate to my hearing team, these issues with the ear canal being a little bit more oblong than circular, having the ear canal contour needs a little bit of a deeper fit. So it's really a decision-making process between the audiologist who's fitting the hearing aids and any other specialist to ensure that depending on the type of hearing aid that you have, if it's a dome size or a dome contour to fit and not completely block out the ear canal so it can kind of breathe or allow other sound signals to come in without any kind of interference, or if it's a custom mold that's needed to completely make sure it's a good seal and fit, but it's still ventilated to allow different sound qualities to get in and not interfere altogether. So the fit is I'll really reiterate this. The fit is so important. So fit physically in the ear to stay in and be easily placed in and out, but also the fit in terms of the tuning with your hearing loss and the system that you have. And that's a little bit of an art. So the art to this is who your provider is in terms of making sure that fit in the ear is adequate and good with your audiologist and plus or minus your physician. And that's why I really advocate for hearing centers. Not only are you providing all the hearing options, but you have multiple feedback in terms of what is going to be a good fit physically in the ear, because that improves or can impede performance on so many levels. And simple thing as, so many times I'll have this example that you have a hearing aid over the ear, you have a dome that's fitting in the ear, but it's not completely sealing off, which is a very common fit. And it simply is just kind of hanging out in the ear and it's not able to stay in. So a lot of times it's just a position and the depth of the dome or a larger dome or a lengthier dome to have that fit be adequate. And a lot of times if you have a simple little bit about wax that's right at the opening, huge impact on how well that fits in the ear to get that better performance. And if you don't have that physician side of things, you may not know that that's a simple issue that could be addressed. So it's kind of an art form, to kind of tell you the least, in terms of getting that right fit for each person.
Can any ENT doctor treat tinnitus?
That is a very complex question. So tinnitus, a very wide range of causes. And I'll try to simplify, or this is the discussion that I have with a lot of patients. Two categories of general causes. One is hearing related, which we try to address that the best that we can, whether it's hearing aid surgeries, what have you. And the other is stress centrally, or stress on the brain. When you have any kind of stress on the brain, that's where it can amplify or bring up the perception or the sound. And tinnitus, just to kind of get at what this really means, is the majority of tinnitus is an adaptation by the brain. So it's not a sound that you're actually hearing, but it's a sound that's created by the brain due to a decreased hearing signal and the brain adjusting, being plastic and creating that sound, or a noise and change that's happening in the brain because of stress in daily life, stress at home, poor sleep quality that has an effect on the brain and a result of increased tinnitus, anxiety, depression. All of these items impact and influence tinnitus. Treating depression, antidepressants bring down tinnitus when it's applied and applicable. There's a lot of different roles or environmental stimulants that can have an effect on the brain that can impact how loud or how noisy tinnitus is. And there's certain medical conditions, not only just with hearing loss, that can impact tinnitus. And there's certain fluctuating conditions like Meniere's, inner ear pressure issues called hydrops that are sensitive to salt and fluids intake. So salt or sodium in your diet, or fluids, or how well you stay hydrated, caffeine, water pills, what have you. And that's where, when we say what state is going to help you best treat tinnitus, in general, it's going to be a hearing center, because you have the physician side of things to kind of give you this input, plus the hearing testing, the treatment of any related hearing loss. And it's really a discussion with each person what these stressors are, whether it's the hearing or stressors on the brain. But what I'll tell you, and what I recommend for a lot of patients, are kind of what I covered for factors, but you'll see a lot of advertising. There's no magic pill, there's no magic potion or surgery to get rid of tinnitus. There's a lot of things that can help modulate or modify in terms of how significant that level is, but there's no magic uniform treatment that's going to take that away. So, you'll see cocktails and different types of herbals out there. I say for most patients, you can try it, don't spend a lot of money. But if you're really trying to look for a solution, feel free to try different methods and techniques. There's a lot of things that are out there. It's little harm and a low risk, but just don't spend too much money or go too crazy, because there's so many factors that play a role. And that's where an ENT evaluation can really help pinpoint individual problem areas for you to focus on.
Well, if friends go to Costco for their hearing test and hearing aids, what's your professional opinion of this option?
So, professional opinion for Costco, they do provide the service for hearing aids, and I'll tell you, they have the most competitive pricing by far, because they buy in bulk, and that's just the nature of the game. They do provide probably the cheaper option as far as hearing aids for the exact similar model. One difference, or I'll kind of give you the general pros and cons. Pros, pricing upfront. The one thing with that is that you'll have to pay everything upfront, regardless of the model or style. With a lot of hearing centers like mine, you'll be able to have different payment options, payment plans. With Costco, they have only a certain selection to choose from. You won't have all of the other variety of kind. What you see is what you get to choose, which, for a lot of people that works. Follow-up, they'll tell you, here's your hearing aid, come back when you have a problem. A lot of people don't know when there truly is a problem, because it's so gradual and it's so slow over time that you really won't know until it's too late, when there's more damage that's needed done for a hearing aid. And the one thing that I'll kind of also say is, even let's say you get a hearing aid from Costco and you want to follow up somewhere for the rest of your care, you can't even do that, because they're the only facility that actually locks their software so that no one else can tune it. And that is kind of telling to me that, and it's kind of unfortunate that even if you buy from Costco, if you wanted your care elsewhere, you wouldn't be able to do that, because the software that they use, they lock it so that no one else can really make any adjustments. So you're kind of locked into the care that you get there, which, for some people it works out fine. But again, they don't have physicians there, so they don't have that side of input. So for a hearing center, that's where I really advocate, is they can at least look at each individual case, have all options at their disposal to evaluate and treat, and have a good conversation on what that might be. And for a handful of patients, we'll still see the patients, and I'll have a discussion with them, and I'll tell them honestly, if Costco is a good option for them, I'll let them know that that's a reasonable option to explore. But if they want to look at hearing aids, other options, they can look at options through us too. And it's another provider, another service that's there, and it works for some people, but not for everyone.
Does Medicare cover the exam or hearing aids?
Yeah, so Medicare does cover exams. They do cover hearing testing. Hearing aids This is another trick question. For straight Medicare without a supplement, currently they do not cover hearing aids. If you have a supplement, it depends on that supplement individually, and that's where we check insurances. Currently, there's, I don't know how political everyone is here, but the current infrastructure bill was passed by Congress. The second half of the bill that's being discussed right now, the social bill, is including hearing aids and hearing amplification coverage through Medicare currently. So it's an actual bill that's in Congress under the Senate to try to create a plan among other social services to get passed and get included. And this is a huge thing. Of course, I'm biased in terms of the effects of hearing loss and treatment. This should be covered by all means. Just like vision is, just like dentistry is covered. There's so many different things in health and medicine that are covered, and it just blows my mind that something as simple as treating hearing loss and hearing with something like a hearing aid is not covered. And I really hope this does get passed, but they're putting together a bill right now to see if this can get pushed to the president to get signed into action. And right now, it's a part of the bill to have hearing aids covered. So to be determined if Medicare actually does.
What is the best approach to minimize wax buildup on your own?
Very good question. And it's different for each individual. If you have anything in the ear, like a hearing aid, earbuds, that's going to contain and keep wax in. But for home care and cleaning, there's not a lot of good options because all of the options are blind. I'll tell you that probably the most effective strategy is some sort of irrigation, which is actually what a lot of non-ENT offices will do, whether it's urgent care or primary care doctor's office, is some sort of irrigation or rinsing technique to kick it out through rinsing. And that's probably the most effective. Anything that you do blindly can potentially injure or damage. And I don't know how many times I've seen that come across, but essentially some sort of irrigation or rinsing technique, whether it's letting the shower water run in and run out to let that naturally rinse through, can help. Of course, it really depends on each person's case, because if you have a history of ear problems, ear infections, the more that you rinse the ear, it can create more problems. So it's very individualized in terms of what works for most people. But if you have a normal ear, normal structures, usually some sort of rinsing or irrigation technique works the best, usually.
There's a comment that some or most Medicare Advantage plans in Southern California cover hearing tests and hearing aids to a certain degree.
Hearing testing, definitely. Evaluations in the office with ENT, definitely. Hearing aids, if it's just purely Medicare, some usually not. Usually it's got to require some sort of supplement. I could be wrong with, I'm not as familiar with the exact details of Medicare Advantage. When it comes to insurance coverage, I know as a default, Medicare does not cover. If you have a supplement, it really depends on that supplement. This is where my audiology department is more educated on what insurances, to be exact, are usually covered for hearing aids. But anything else currently that's a hearing test, an office visit, an evaluation, those are covered.
Does your office offer a discount for non-insurance folks?
That's a tricky question. On certain case bases, yes. It really depends on each scenario. We really try to do our best to, provide the best services we can for our community. And it's a common thing that we see in and out. We try to essentially tailor the care that we can. So, example, coming in for a hearing test, if we can knock out, an evaluation, hearing test, all in, everything in one visit, we'll try to do it, keep costs down. It really depends on each individual situation. We try to do our best, whether it's using a hearing test from an outside place that you might be able to get reliably. It really kind of depends on each scenario and situation. because Costco does do free hearing tests, but they're not all hearing tests are created the same. So it's kind of hard to trust certain places when sometimes the testing doesn't look reliable. So there's certain parts to it that we try to make it individualized, but the short answer is we try to do our best to kind of accommodate everyone's situation the best we can.
Two more questions. iPhone versus Android, is one better? Does one work better with hearing aids versus the other?
Good question. Technically, all of the smartphones nowadays are going to be capable to work with hearing aids, whether it's Bluetooth, pretty much the standard. All phones are equipped with Bluetooth. Certain companies of hearing aids are already built in to be compatible, just because of their wide ability to have software applications. In my opinion, I'm not very familiar with the other platforms. I'm biased because I have an iPhone. I've had it for many years. To me, the usability is very high and very frequent. I'm going to just say iPhone. I don't know 100% because I don't know the other phones that well, but I'll tell you the workability and the usability of the iPhone is very good with hearing aids and Bluetooth in other accessories, but so are other phones because of Bluetooth. Bluetooth is such a standard nowadays with smartphones that you'll be able to use any other phone with a hearing aid very well. And there's a lot of options. It just depends on the place that you go if they have those options, but there's ends on ends of options that are out there that it shouldn't be an issue with picking between phones. It shouldn't be an option or an issue rather between picking between phones.
I hear advertisements for Miracle Ear. Any comments on those devices?
So Miracle Ear is a facility that's in the Fullerton area. They are basically a hearing aid center. They provide hearing aid services. They don't have physicians, but they do provide hearing aids and provide services. They're an option like anywhere else as far as providing those. And if you currently are working through them and getting hearing aids and getting care, they're a good option. They'll have hearing aids and different types of testing for you. But again, Miracle Ear is just a place with audiology, so no physicians that are with them to provide that complete hearing center level of care, but it is an option.
Okay, so we've run over our time quite a bit now, so we're going to have to cut off the questions now, but we'd like to thank you, Dr. Sugihara, for giving this talk tonight to us. It was a lot of questions. It's an area that I think a lot of us senior people have a lot of issues with, and I think this was very helpful.
I'll tell you, if there's a lot of questions elsewhere out there, I'll be happy to answer them. If I don't know if they come in some form, whether through emails or anything like that, I'll be happy to respond if they're posted in some way, or if you want to come in and talk more about it in the office, whichever have you. I'll tell you that probably the lengthiest of visits are always these that have questions and conversations. And anyone that comes through the office, one goal I have is try to answer everyone's questions so you leave confident that you have a good understanding of what's going on for each individual. So a lot of times we spend a lot of time with our patients on these kind of questions and topics in the office and even outside. So anytime with questions, I'm happy to answer them.
Thank you very much. I really appreciate it. Bill, thanks for being a great host.
Okay.
Thank you guys for having me and listening.
Okay. Thank you for this. Well, so next week, I don't know if Carol, she lost her audio, so she can't tell you what's on next week, and I don't have the schedule in front of me, but it'll be next Wednesday morning at 9 a.m. And look in your OLLI News Bites or your online at OLLI to find out what's on next week. Thank you all for attending.
Thank you. Hey, Bill, did I hear correctly you're going to send out the presentation or it's going to be available?
This presentation was recorded,
Okay.
and so you could go back and watch it.
Okay.
Um,
Great.
It's on the OLLI website on the distance learning area,
Okay.
and it'll have the link to Vimeo there. And so you could just click on the link and it'll be available probably within the next 10 minutes.
Great. Thank you very much.
Okay.